This video is going to attempt to show a way of using an elasticized bandage to support the injured groin muscles. These muscles are commonly injured in sports such as hockey, and I've used tape here to identify the muscles. So we've got a set of 4 of them. We've got a couple of short adductor muscles, and we've got a group of longer adductor muscles that go all the way down into the knee area. Now, in this particular case, the injury was to the short muscles, which means we're going to start strapping this bandage starting from the middle of the thigh, as opposed to if it was the longer group, we might continue that a little bit lower down. We're going to be using a few things here. We want to do this in a standing position so that we have access to all of the areas that are going to be wrapped, and this is going to include the thigh as well as into the lower portion of the stomach. We have 2 elasticized bandages. They are the wider variety, not the narrow type. And we've got number 1 and we've got number 2. A few tips to try and improve the way that this is wrapped. When we roll our elastic bandage down, we're not going to roll it down with the roll on the body, because that's going to make it harder to apply equal tension. We're going to roll it so that the rolled up bandage is away from the thigh. We're also not going to wrap like this, where we're going cross to cross from left side to the right side. That's going to create a lot of compression and it's going to restrict blood flow. The idea is going to be that we're going to start with one roll down, and then the next one is going to come up. So we're going to go down and up, overlapping each one by about half. Because we're talking about an injury to the short adductor muscle group, we are going to start along that area just slightly beneath it. And from here, my first roll is going to be to roll down. And now once I roll down, I'm going to do my next roll up. I should also mention that for the sake of modesty, this is being done over clothing, but when this is being applied, this should be done directly over top of skin. Because my first roll was down, my next one is going to come up, and you'll notice this creates a V pattern as opposed to a cross pattern. For each roll that we are doing, we are going to attempt to overlap by at least half, and because I went up with the first one, with the previous one, I'm going to come down with the next. I'm going to come up with the next, and you'll notice that there's a nice alternating pattern of V's into this area. I'm applying enough tension, but not too much, so that when I'm actually going and trying to lift up, I can still put a finger underneath each of these. So this is where we've now run out of room for that first bandage. And from here, I'm going to pin this down using the pins that were provided by the packaging, by the manufacturer. I'm going to pin this down here as well. So now we have our first strap in place. It's not, you'll notice that I have these nice V's that are appearing into the area. Each one is overlapped, and I'm not feeling as if it's excessive compression. Now the second wrap, we are going to perform a similar type of strapping. We're going to start a little bit higher up. This one is now going to assist the action of the muscles, which they are the ones that assist with bringing the leg forward when we're walking. To assist with that, we are going to start the roll towards the back of the leg, and I'm going to loosen up enough of it so that I have the ability to start it here, to wrap it around so that it's nice and secure. And now from here, I'm going to continue above my waist. I'm going to run it up along the buttock muscles. I'm going to continue it along to the front. I'm going to come down one more time into the thigh. I'm going to come back up with tension, and I'm going to run along the waist again up the buttock muscles, across the abdomen, down into the pelvis and into the thigh area. And from here, I'm going to now strap the final portion down. So I'm going to strap this down to here. We're going to see if the second pin wants to hold. I'm having a little bit of problems with it today. And we are going to allow that as my pin finally decided to break. It's holding a little bit there. We are now going to remove the puck from underneath my leg, and the patient should be noticing that There is compression, but it's not feeling too tight. They shouldn't feel like they're losing circulation in the foot. What this is attempting to do with the second strap is to assist the ability of the leg to now swing forward. So that's where the tension on the band is. In order to assist with that, I had the leg in a slightly forward position to start off with, not in line with the other side of my body. And that means now every time that the elastic band goes on stretch here, it's providing a little bit of passive support for what we would call the swing phase of the walking cycle.